There's food. I want to introduce you to Dr. Doris Rivadas. She's one of our retirees, our faculty emeriti for the college, and she has spent a number of years, I'll just say it like that, working in this area, and so it's very knowledgeable. You all feel free to engage in discussion with her as she goes through this topic of literacy. Thank you for coming.
Hello, everybody. Let me figure out, thank you. So let me figure out how many people are students. Okay. Those of you who are students, how many have taken the health literacy class here? Some folks, good. So some of this will be a repeat for you, probably. How many people in here are nursing students? HHS students? Occupational therapy. Okay. Yay. All right. Others? Other students? Okay. Faculty? How many people are faculty? Okay. All right. And I think I know most of you. Okay. So I gave you a handout, and I'm going to give you a little scenario, and then I'm going to have you turn over the handout. I'll tell you what to do with it. You have just gone to your GP for your yearly physical. You've been under a lot of stress lately. After all, it's near the end of the semester, right? And you've not been able to sleep. You've got terrible headaches. You've got aches all over your body. When you do sleep, you wake up sometimes and you got numbness in your arms. You're talking to your GP and you're saying, I don't know what to do about all of this. In addition to this, you've had some trouble with diabetes, but it's in pretty good control, so that's not a big problem, but you're a little worried because you've got this stress stuff going on. Okay, the GP looks at you and says, okay, I know what we can do. And he says, I'm going to be back in 5 minutes. And he gives you this handout, and he says, we're going to talk about this. So turn it over and look at it for a couple minutes. I should have given you one, Betty.
No, I have one.
Oh, okay.
Remember, I'm the one who said, this is wrong.
Oh, that's right. Okay, your doctor's coming back in the room. How do you feel about this? What's going on? What are you going to say to this doctor? You were confused? And then?
Well, then I realized.
You figured it out? Yes. Okay. Other people confused? Okay. How do you feel about being confused? Frustrated? Anything else? Nobody's angry? You could be angry about this. You could feel, like something's wrong with you, that you don't understand it, right? There's a lot of different things that can happen here. What is your doctor going to suggest? Anybody figure it out? Oh, nobody's figured it out? What? Carpal tunnel surgery. It's an informed consent. Well, it's not really an informed consent because there's no information for you here, right? If you didn't figure it out, there's no information, right? Informed consent is not the form. Informed consent means that you're informed before you give consent, right? The form is just one part of that. But it's a pretty important part. So if you cannot read, that would be your experience, right? And you may not think that people have there have been people that just signed forms and didn't know what was going to happen to them, right? Not even what's going to happen, let alone what the side effects might be. Okay. So let's talk a little bit about health literacy. There we go. Okay, which is the best predictor of an individual's health status? Age, income, race, ethnicity. Oh, look at, I kind of gave you the, I thought that was going to, activate that, but okay, so literacy skills are the best predictor of an individual's health status. Now, you may have been exposed to some of these other things as predictors, right? But this is one of the things that we do know about health literacy. Nope. Well, what's going on here? 75% of patients who reported being in poor health also tested in a below basic health literacy category. And I'll talk to you a little bit about that study with the below basic. We also know that 50% of US adults read below an 8th grade level, but patient materials are often written at a 10th grade level or higher. So when you give people patient, basically this means more than half of the people that don't understand it. That's pretty overwhelming to think about. So what's health literacy? So this is a definition that was put together in 2000, but it's still used in healthy people. The degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So notice there's several different parts here. Understanding, not just getting it, but understanding it, processing it, and then there's an action element to it. It's to make those kind of decisions. Here's some more scary data that we all need to know. It's a pretty large study with 2 gigantic public hospitals. They found that 33% of patients were unable to read basic health care materials. 42 could not understand directions for taking medications on an empty stomach. 26, unable to understand information on an appointment slip. If you don't understand the appointment slip, you don't even get there, right? So that's a pretty amazing finding. 86% do not understand rights and responsibilities section of a Medicaid application, which is how you get your health care, right? 86%. Has anybody in here ever seen a Medicaid application? Oh my gosh. It's not surprising. And 60% of the patients did not understand a standard informed consent form. This is when it's not in Pig Latin, right? So we are working on some of these things. Our local hospital, if you look at the end of the form I gave you, it has a little teach back element. So Bronson does that. I have to say that I have actually been to Bronson providers, and they just told me to sign without a teach back, even though it's at the end of the form, right? But a lot of hospitals are working on rewriting things, which helps tremendously. Okay, one more thing. I'm going to have you turn to somebody near you. You can do, 2 or 3 people. What literacy skills do you need in this scenario? So the scenario is you're in the process of moving to a new area of the country, and you have been having tooth pains. How will you solve this problem, and what literacy skills would you need to do that? So I'm going to give you a few minutes to talk about that. All right, good. Let's talk a little bit about it. What do you need to do? I like to use dental examples because, you know, I usually don't have dentists in the audience. So what kind of things do you need to do? How do you find help? Yes?
Understand the specific dentist you're going to accept your insurance from.
Okay. After you find them. Yes?
I was just going to say you have to find a local dentist office first.
How?
I normally Google it.
Okay, Google. Other ideas?
I was going to say, older people that might not know how to use the internet as well, might not be able to look up and see.
Yep, yeah. So first you have to do some of that. Anybody thought AI? Another possibility, right? Right? And then once you do that, you do have to find out about health insurance. What other skills do you need?
You might need to know how to talk to the dentist about if you need to take any medicine before you come to the dentist appointment and how to follow those instructions.
Yep, the instructions you have there. Also, you need to know if they'll see you in an emergency, right? If it's that at that point, right? So you've got to have that too. Anything else?
You gotta be able to tell them where the pain is.
Yep.
It's in my mouth.
Yeah, you have to describe it a little bit more, which can be tricky.
That can be tricky.
Yeah.
To be able to write down an appointment.
You have to write down the appointment. And we're missing at least one here. So the searching for information. You know about the culture of healthcare? So I have done a talk with dentists, and they tell me that dentists are in the emergency room, that there's usually a dentist on call in an emergency room. I had no idea, right? The searching for the information, if they have emergency services, who do you contact? Reading and comprehending different kinds of information. Numeracy and spatial skills for figuring out health insurance. Numeracy means working with numbers. Spatial skills means like you got to figure out how to get there, right? You got to navigate there. GPS helps a lot because it talks to you. I don't know about you, but there's a lot of places I go frequently. I don't know how to get there without my GPS because I always use it, right? So that happens, but okay, so there's more than reading and writing to literacy skills. And we're talking about basic literacy skills just to get you places to figure out how to engage. This is the biggest health literacy test that we've had. Unfortunately, it's quite old, but some international tests have kind of confirmed it. They're not exactly the same thing. But this is the National Assessment of Adult Literacy. They have a health literacy section. And 77 million people took this, right? And 77 million people have basic or below basic health literacy. Below basic health literacy means that maybe you could read that appointment card. Basic literacy means maybe you can work on, read a pamphlet and get most of the pamphlet information in there. Intermediate means you might be able to read quite well and be able to navigate quite well, but not understand things that are a little bit more complicated like complex disease, diabetes, cancer, all the information you need for that. And then proficient means you can do it, right? So basically, 35% cannot reliably read and take medicine. So at that below basic and basic level, in Kalamazoo County, there are 25,000 people at that level. So they're not getting most of their information, right? 25,000, there are 18,000 people on campus here. So that's that many more that are in Kalamazoo County. Kalamazoo County is not that unusual. This is not, it's similar to other counties as well. That test that I was just talking about, the NAL test, also looked at different categories of people and who had more limits on their basic health literacy. People with a lower education, the lower your education, the more likely you are to have lower health literacy. People taking Medicare and Medicaid, and also people in poverty, which probably go together, right? Older adults, and people of color. Statistically are more in those lower categories. Okay, so this is where I need some help. This is a simple thing for you. I'm gonna give you some directions, and I'm gonna can you come up here? We have 3 things I want you to follow directions for. Okay, the first one is, if you're happy and you know it, clap your hands. Good.
Mira a tu izquierda y sonríe a la persona cerca de ti.
No, not many.
A couple. I saw a few.
A few people, okay. Mirk tele ete. Nobody. Okay, first was in English, second was in Spanish, the third was in Lithuanian. I asked you to blink in Lithuanian. And I didn't think anybody would know that, except for Maureen, maybe. So if you are speaking a different language, what happens? Anybody travel internationally? Anybody need help internationally? And what happens?
I pick up on stuff much slower, or I'm trying to look at a translator app.
Yeah.
To figure out street directions or signage or something like that. So it takes me a lot longer, and I have to pay attention, but I don't literally step off a curb. Mm-hmm.
You could all follow my first direction easily in English. In Spanish, some of you did quite well. Some of the others of you, what did you feel like when people did something when the Spanish was going on? Not included, yeah. And I just went to a health literacy conference and they did something very similar. And my Spanish is pretty slow, which is why I asked for help. So I was still trying to figure it out by the time people were doing things, right? So it's that processing element. But people that speak another language, non-English language speakers, are struggling with healthcare. Yes, we do have interpreters, but there's a whole bunch of elements of that, which include sometimes the healthcare being different, right? And how you go about things being different. I know somebody who called an ambulance, an immigrant who called an ambulance here, thinking that you just call an ambulance if you need to go. It was not really an emergency. Got $2,000 bill for the ambulance, right? Had no idea he'd have to pay for that ambulance bill. So a lot of that has to do with that. So beyond reading and basic literacy is language issues. And I'm hoping this video will help. Uh-oh. Will work. Because when I went to the website,
I even started to notice some of the hair growing back at the end of the first bottle.
oh no, I don't have any video.
Changed my life.
It comes in a little dropper. You just drop it all over your scalp and then just massage it in.
I am
What?
thrilled with the results.
In the 3 months that I've used this product, my hair has grown.
I started experiencing hair loss after.
I mean, I can
my
skip that,
pregnancy.
but I need the
2 years
visual.
old, my hair had started to thin. Every time I showered, every time I brushed my hair,
Okay,
I had this clump.
do you know?
Bald spots
I don't
that
know.
I had were atrocious. delicious.
I started using this Pro serum from Vegamore.
This is a commercial, so.
Felt like maybe that's where my trouble area was.
I can feel it coming back. I can see it coming back.
It is just doing wonders for my hair.
It's so much thicker than it was
Is it?
before.
It's rarely
No, I just
shed.
need
They are
the
vegan.
visual. There we go. Thank you.
So how have you been? It's been 6 months.
This is where I need to go.
What's new? What's exciting? Good, good. Everything's going.
Can you see this?
All right, so
Dentist again, right?
patient presents the class 1 occlusion. Got a little suction in there. Overbite is 30%, overjet is 3 millimeters. TMJ, let's check that. Open it for me, Nico. Have an overbite? Oh. Good close, no clicking. Patient has a convex profile. 20 is slightly rotated labially. The anteriors have prominent mamelon. Wait, what? Bicuspids can optionally be sealed. And interproximals tight contact. All right, everything looks good. See you in 6 months.
Uh,
Come on up.
okay. Let's see if I can get back. No, but I'm back at the beginning here. I can't see my cursor, which is the problem here. Okay, so talk among yourselves. What was that like? Anybody know what's going on? Okay. All right, does this look familiar to anybody's dentist? So most people in here are English speakers, English native speakers, and all of you speak English, right? I'm assuming most of you have pretty good literacy, basic literacy. Why don't you understand the dentist? It's jargon, right? And we don't have that jargon. So it doesn't help us when we leave then to know what actually happened, right? And of course we have our mouth open, so it's even harder to ask questions, right? But jargon is an important part of health literacy. So we can't just say people are limited because their reading skills, their navigation skills, their English skills. Perhaps there's some problems on the other side, right? So if we look at, oops, sorry. One more thing I'm going to ask of you. So we've got the reading skills, the English skills, the jargon. What if somebody is speaking clear language, but they say to you, let's say your GP comes back and says, well, you know, I looked at your labs, what you're describing, you have cancer. And then they go on to tell you a whole bunch of things. Are you going to understand the rest of what's in there? No. So another thing that's important is our emotional states, right? So when we think about health literacy, the number of people with health literacy challenges at some point in their lives are 100%, right? Because of the specialized terminology, the emotional nature of healthcare, differences in culture, reading abilities. There are many, many different elements to this. So really, improving health literacy comes down to all of us. Remember this? When we first looked at it, we were talking about our fundamental literacy. But if you look closely at here, there's another side to this, right? What are the basic health materials made of? What are the directions made of? You know, that when people read, another study says, when people read, take one pill twice a day, there's a lot of people who say, yeah, I can take that any time in the day. And they take them both at once because I might forget later, right? So that's our explanations aren't always so great. Appointment slips can be a little confusing, not for most people, but there are ways to make them better. Rights and responsibilities section, definitely ways to make them better. And standard informed consents are challenges, right? So health literacy really has to do with two sides of a coin. The individual patient's skills and abilities, but also plain language and clarity of the health message, right? So there's two parts to that. And we are all in here because we're on both ends, right? All of us are patients, but we're also in charge of giving information. So what do? So one thing we can do is to use universal precautions. Can someone tell me what universal precautions are? Have any nurses? What? PPE is one. What else? Why do you do that? Okay. So you prevent a spread because you're going, okay. Any other ideas for universal precautions?
Washing your hands.
Washing your hands, okay. So when you use PPE, you might know that somebody has infections, right? When you're washing your hands, you don't know. And so we're taking precautions by washing our hands because we don't know who we could be passing things from, right? And if you think about the pandemic, you can think of all this, emphasis on, the germs on our hands. So we can do that with health literacy. It's a little bit different, but we can use universal precautions. So here, to prevent spread of germs when you don't know who has them, to build health literacy when you don't know who is not understanding. So one thing is to be aware of jargon. Another thing is to use plain language. So what can providers do? There's three sections that I think of for use of plain language. One is verbal communications, written communications, and digital communications. If we're looking at verbal communications, you can use eliciting questions so that you get an idea what people are interested in. You can paraphrase back to them because people want to know that you heard them, right? You can adjust phone conversations for a lack of visual cues. When you have something in front of you, you can point to somebody's knee, but you might have to adjust that a little bit. Use visual aids, body language, metaphors. Metaphors work really well, particularly if you know your client really well and can, you have a plumber. It's easy to think about how a plumber might talk about their body parts, right? And use teach back. Who knows what teach back is? Yes. Can you tell us? Yeah.
It's when you ask the patient or client to reiterate what it is that you just talked about, or even demonstrate an activity that you're showing them.
Right. So you're asking them to repeat back or demonstrate, right? Why would you do that? You want to know if they understand, but you know what you really are looking for? Did you explain it well for them to understand, right? Because really is, how do I need to adjust? Because if they don't understand it, if they can't demonstrate it, if they can't, if they can't tell you, then you need to adjust in how you explain it. I don't know if any of you have ever seen, there's a great clip from House. And he has a patient who he has given an inhaler to. And she keeps coming back and says, this isn't working, this isn't working. And he said, well, are you spraying it? And I'm doing just what you told me to. And apparently he hasn't used Teachback, but finally he says, okay, I want you to show me how you use your inhaler. Oh, I can't believe you're doing this. And she takes out her inhaler and she goes, and she sprays it in the air around her. If he had done that in the beginning, then, and had her show him, then he would know more, right? So Teachback is a valuable tool. Written communication. Generally, people do better with short words, short sentences, right? Use of white space. Have anybody ever gone to documents like, terms of use, and all it is just all letters, no white space around it whatsoever. Like if, you go on a website and they say, you got to sign the terms of use. How many people read those things? No. And if it doesn't have any white space, you don't do it at all, right? I mean, it just doesn't even make sense. You don't have any headings or anything like that. You can define unfamiliar words. There are things online that would tell you what grade level things are at, and be able to count the grade level. And I said earlier, we do have some trouble with grade level. That isn't the end of things, though. For instance, some of those automated systems wouldn't let you use a diagnosis, right? But you're going to have to use a diagnosis sometimes if that's what you're talking about. So it's really kind of better to kind of define that as you go through, right? I mean, I think you can use those, or actually they're in health literacy now, there's AI stuff, right? So, you can actually use AI to use more plain language. You do a prompt with that. But you still have to look at it. You still have to think about, who is my patient? What will they understand? What culture are they from? Those kind of things are really important, right? And then avoid medical jargon and vague kind of comparisons. Sometimes we compare things in a way that doesn't work very well. Written communication also works well with some visuals. I didn't put that in here. But if you're writing patient communication, or even if you're talking to somebody, sometimes, I don't know if you've ever had a provider that draws, or they grab something to show you, that those written communications can add to, the verbal communications. Digital communication is the new challenge, right? So, and some of these things you're not going to probably do as the provider, but you may do in your office, and somebody else might do it, or you might look for other people to do it. So things like teaching navigation of recommended websites. So many providers you go to, and, they say something to you, you go away, you go online, right? And you go back, and they never ask you if you have been online. So you don't know if, what that person has gotten is good. If you can recommend a website for something particular, it's really helpful. And I guess my suggestions for that are to use like office staff to do it. People that are assistants, like medical assistants, people like that. PT assistants, OT assistants might be able to kind of find good websites to review with you, right? Use visual contact and metaphors to educate. This is and you can use that like, a lot of places are now giving iPads in the waiting room, or there's a TV up in the corner. Sometimes those things can be helpful. And that's the use of digital platforms. Teaching navigation of patient portals. This is hard for some people, to kind of find your way around them. I have to tell you that I have talked to every patient portal company I know to see if because I do some education at the Kalamazoo Literacy Council. I want to teach this, and nobody will give me a shell. So that's hard. But if you can briefly say, we'll have our computers out anyhow if you're in a consultation, right? You can kind of pull people over and say, this is how you talk to me on the patient portal. This is the conversation section. Please feel free to use that. Or this is how you order your medicine, or whatever you're going to use, right? And then limiting phone prompts. These automated phone systems people hang up on. They're not really worth much. Okay. And what type of information do we use? So, I've given you some information examples, but consider things like our health recommendations, test results. Test results are tricky, but we need to think about those kind of things. Payment and insurance information. Health insurance literacy is almost non-existent, right? We all struggle with that, right? So that's something that's important to look at. Consent documents we've talked about. Directions to the clinic. Patient education we've talked about. Navigating the healthcare system, being able to get around in the healthcare system. Think about things like one time, I'll give you an example. One time I went to the doctor, and I'm signing in at the desk, and the woman says, "Do you have a DNR?" And I said, "No." She said, "Oh, yeah, you have a DNR." I said, "I should not have a DNR." And she said, "Well, it's right here." And she shows it to me, and it's a form that on the top says, "Do not resuscitate." But within the thing, you can say, "I want to be resuscitated." The name of the form is a DNR. It's like, I said, you need to change the name of that form. It's not good communication, right? And also think about things in navigation, like your doctor might say to you, go and get your labs. Go to the lab and get your, the labs I've given you. And you go to the hospital, and you can't find anywhere where it says labs. It says outpatient testing or something like that. Different terminology, right? And it's easy to fall into that because you don't always know what's being done elsewhere. But that can be very concerning for people, and they often can't find it. So I'm going to stop here. Questions, comments about what can be done on the provider side? Yes.
I just have a quick question on the study that was reporting like 77 million impacted, and one of the categories was older adults. And I'm wondering if in that study they offered materials that had a different size font?
I don't really know that, whether that, but that's another issue, right? You know, if you can't read it because it's so big, it's so small. And older adults, of course, have trouble with medications for that reason, particularly over-the-counter medications. Yeah, good point. So I should mention, too, that the NAL test was, you know, we think about, you know, you're going to test literacy. Often people think, well, what grade level are you at? It was a test of functional kind of, how do you do this? Look at this appointment card, and what do you do from here? Look at this document, and what do you do? If your doctor says such and such, what does that mean, right? So it was really a test of those kind of things.
And they also have like a label for
Yeah.
medication.
Medication label, yeah. Interesting, medication labels are a whole separate area of health literacy. For my sabbatical a few years ago, I worked in Dublin, Ireland, with pharmacists on becoming literacy-friendly pharmacies. And we were giving them awards if they could, you know, do things well. So we looked closely at their medication labels, and their medication labels, they when we investigated this, they said, we cannot change the take one tablet twice a day. We can't change that to take one in the morning and one in the evening, which is a clearer direction, right? And I said, well, why can't you change it? It's because of their EMRs. Their electronic medical records would not change it. It was built right in. So they had to kind of adjust from there. Luckily, in Ireland, there are only 3 EMRs. And we worked with the pharmacy union, which was the professional organization for pharmacists. And they worked with the EMRs to change it the next time they actually changed their system. Because if they wanted to change it right away, it would be too expensive, right? Okay, other questions? Yeah.
Were they able to, like, I know now on my prescriptions, like, I get a pamphlet on the front of it.
Mm-hmm.
Could they put those directions, like, in those, or are you saying, like, it would only be valuable information on the bottle?
Well, in Ireland, they don't have that. But what you're talking about is, I'm trying to remember the name of it, universal. I can't remember the name of it, but it's the most research prescription label that gives you actually even sometimes pictures of, you know, each time of the day, and then you can figure out exactly where it is. There's still a lot of places in the U.S. that don't do that. Yeah. But yes, I mean, most of our systems can do that. Did you have your hand up, or? Yes. Yeah. Yeah, and patient portals, I think, are tricky for practitioners because they have to figure out when they're going to get in there and, you know, and try to, you know, figure some of that out. I know I've gotten that, too, where I've got it from the lab and the doctor hasn't been in there yet. Yeah. And then I'm looking at it and saying, oh my gosh, that's a lot more than I should have or whatever. And then the doctor says, well, you know, it's because of this. And they, oh, okay. Other ideas? I bet we could all think of things that we wish were different. Because the advantage of becoming a provider is that you've been a patient, right? And so we have to kind of remember our patient experiences sometime to help us and become better providers. Okay, I wanted to bring up vital conditions. Has anybody ever seen this? It's similar to social determinants of health, but it's being used now. It's a little bit more about kind of the positive, how we can help people thrive instead of just kind of help them survive, right? And the idea of this is that at the center of it is, the research has kind of shown that we thrive when we belong. When we have what they call civic muscle, which is basically we're involved in our community and making things better, really. And that's at the center of all of these. But we think about reliable transportation, thriving natural world, the idea that we can be, in a place that has clean water, et cetera. Basic needs for health and safety, humane housing, not just housing, but housing without mold in it and that kind of thing, right? Meaningful work and some kind of wealth, not wealthy, but something. Lifelong learning, and I already said reliable transportation. If we think about all of these things, or you even think about social determinants of health, which you might be more familiar with, literacy plays a role in all those things too, right? The ability to understand some of those. And the other side, where practitioners are with health literacy, there's another side to all of these things as well. It's very hard to, it's wonderful if you land in a place with clean water and clean air and you're in that great natural world. But if you don't and you want to fight it, you need clear information given to you and be able to also work on that clear information. All right, just a couple things I want to mention about health literacy opportunities. So the first one is we actually have a health literacy class here. And that's why I asked some of you have taken it. Anyone can take it. And it does have practice on all these levels within that class. So it's HSV 4860. I also wanted to mention that we do have a Michigan Health Literacy Coalition. I'm the person who runs it, so this is our Facebook page. There also is an international organization that's based in California called the Institute for Healthcare Advancement. So this link, IHA for Health, they have like a solution center, so they have lots of different things in there. They run a conference every year that's, it's been online, and it's probably going to continue to be online. But they also have I think it's kind of unique, it's a listserv. So there are people from all over the world that you could go in there and say, I'm working on a particular kind of cancer. Has anybody been able to figure out how to explain this in plain language? Right? And there are 5,000 people in this listserv. So you usually get one or two at least people responding. So it's a great find. They also have training for what they call a certificate to become a health literacy specialist. So it's a certification program. And another one is, if you want any additional training, is the CDC has a website where you can find health literacy skills and training there. And then the last one is, there's a gigantic toolkit online that is made for general practitioners like offices, right? But it has like, how do you do teach back? Where can you do plain language? What would be a good way to do navigation? I didn't actually mention wayfinding, finding your way around some of these giant hospitals can be tricky. Places are using, like QR codes now and things like that. But internal GPS, those kind of things, but they can be tricky. So this has all sorts of elements to it, and you can just pick a little bit and look at it. It has like if you are in a in an office, practitioner office, it has like a test for how good is your office in these areas. And then you can pick the tools that would help you with that. Okay.
Well, thank you.
I'll be around if you have any more questions.
Yeah, thank you so
Oh,
much
thank
for
you.
coming.
Thank
We
you.
appreciate you.
Thank
Thank
you.
you all for coming. There's more stuff. There are dogs out there. You already heard the dogs. Go pet a dog.
There's dogs out
We are happy